we developed the concept of dashboard for Parkinson's, and it's been published as the Chaudhuri's dashboard, which I'm very happy to be involved with. The dashboard came out of many concerns of our patients, really, and it touched on the subject that in many of our clinical consultation, because of time constraints, because of that we might have to see lots of patients in clinic, we're missing out on what we call the vitals. Charting the vitals. So the dashboard is a collection of 5 vitals of Parkinson's. So one is a basic assumption or assessment of the motor function, the movement problems. And that you can assess by a simple scale called Horn stage, which has been there since the 1960s. Second is the non-motor assessment. The very quick way of doing it is asking the patient to complete a yes-no scale called the non-motor questionnaire, available globally from many, many societies, and the patient can complete it and take it to their doctor. The third vital is vision, oral, and gut health. Particularly relevant, for instance, if you're taking levodopa tablet, let's say Sinemet or Madopar, if you then have a drink of milk, about 40 minutes, within 40 minutes, the absorption of the drug is really reduced. So just by simple advice like that, or eradicating a bacteria called Helicobacter pylori, you can improve the absorption of your levodopa and make your control better. But a lot of people don't do it. So that's the vision, and vision is same. A lot of people have problems with vision at night because retina is very rich in dopamine. And if we don't address that, these people might fall at night because they're not being able to see properly. Oral health is also very important, at least one gum check once a year. Vital 4 is bones. Approximately 2 in 4 women and 1 in 5 men with Parkinson's will have osteoporosis over the age of 50. But often we don't check for that. A simple fall will lead to fractures in that case. Patients with Parkinson's, particularly over 50, should be on vitamin D, should have their calcium monitored, and should have their bones monitored. So that's the other thing. And final vital is a vital 5, is to look for co-medications. Dopamine agonists can lead to impulse control disorder, check for that. Older people, particularly with cholinergic problems, should not be given anticholinergic drugs, particularly those with the index of 3. And so it's important that it's just a checklist. And now we've implemented that checklist in another global program, which is being led by my colleague from Poznan, Poland, Karolina Popławska-Domasewicz. And what she's put together with myself is a global network of trying to implement this in a global basis with 20 centers around the world, and try to see whether we can mix the subtyping, all the 5 vitals, in clinical practice. And that's what we call the stepped care program. And we will report data from that probably in the next 3 to 4 months.